When you talk about moving to an endemic COVID stage, what do you mean by that? In fact, I remember at the MTF, there was a talk about the new normal. What exactly is the new normal going to be?
Yeah, I don't think it will be totally like before, but it should approximate how life was like, so that we feel that life can go on and my life is not on a standstill. There are a few psychological milestones. We sort of alluded to them in our op-ed piece, but we just imagine. Today, if you are sick with COVID, you are isolated. Yeah? Doctors will assess those who they think is a bit more risky by age, by comorbidities. You may be admitted to hospital, even though you may be fine.
Right.
Or we may think that you are high risk, hospital and CID. Those who are less risky go to community care facilities where there are doctors and nurses as well. Can we imagine a time where the default is to say, here's an MC, go home, isolate yourself, rest, and here's a bunch of test kits. You test yourself every X days until you are fine, then you can come out. Let your employer know, and your employer should allow you to just stay at home and don't demand your MC. That's a big change from now. That is part of endemic COVID. Can we imagine that? It's a big psychological shift, right? That's just one. Two is today you get an SMS, you're quarantined. Can we imagine a day where your SMS doesn't say you're quarantined, just say you are exposed, go home, get a bunch of test kits, test yourself, isolate yourself, don't move around too much, just go out for essentials, So quite a different concept, right?
Actually,
third shift, whether we can imagine you can start to travel, no SHN, at least to selected countries that has also brought down the infection rates. You see many parts of Europe already like that. You see the US cases crashing down. You see Japan, Korea. Japan stable, Korea also quite stable. And then there are also the Asian countries like China that has more or less keep it to a very low level. Can we imagine just taking a test, going there, taking a test, coming back, no SHN? Right now, all these are not quite imaginable, but these are the key milestones transiting to endemic COVID.